Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor, and this is a video about the safety of ozone therapy. I posted a video about ozone therapy semi-recently, and someone was asking, are there any conditions where it's not safe to use ozone or it's contraindicated? So it's a really good question. Considering the safety profiles of any type of treatment is always a really good idea, and something that, as clinicians, we always need to keep in the front of our minds. And when it comes to ozone therapy, in terms of intravenous ozone therapy, and if memory serves, I think that was the topic of the video. Too much has happened since then. In terms of IV ozone therapy, there are relatively few contraindications for using IV ozone therapy. Some of them include uncontrolled hyperthyroidism, pregnancy, because nobody's ever done any studies in pregnant women with IV ozone, and nobody probably ever will, just in case something ever went wrong. So we just don't do it for those reasons. Being intoxicated with alcohol is a contraindication, as a point of interest. We don't really have intoxicated people that come into our clinic to get IVs done in general, so it's never been a problem for us. If someone has an issue with something called a glucose 6-phosphate dehydrogenase deficiency, or G6PD deficiency, then that's something that is a relative contraindication to getting ozone therapy done. And let's see here, those would be the lion's share of them. I guess if someone had really low platelet counts, that would be another reason to potentially be concerned about doing that, to doing the ozone therapy. That's about it. There are some relative contraindications slash cautions with someone who's already on either an anticoagulant or an antiplatelet therapy, because generally we mix some heparin in with the blood that's being ozonated, and so that having its own effect on blood viscosity is something that we have to take that into account. So usually it just means modifying the dose of heparin to some extent, but that's about it. So generally, not a lot of contraindications to doing intravenous ozone therapy. And in terms of the safety profile of it, in my clinical experience, I can't say that I've seen any side effects from intravenous ozone therapy, at least nothing that's been obvious. I've certainly seen, or I should say, I haven't seen any adverse reactions. So meaning I don't think that the ozone therapy itself has been damaging to a person that I've used it with in any way, shape, or form. I've certainly seen responses to it that are unfavorable, from the point of view that it seems that folks who are dealing, especially with chronic infections, can sometimes have a flare-up reaction or a die-off reaction or Herxheimer reaction, depending on what you want to call it, from the treatments. That happens, in my experience, very rarely. It does happen from time to time, but it's quite rare compared to a lot of other therapies, compared to, say, high-dose intravenous vitamin C, using artesunate therapy. There's a bunch of different agents that can be used for antimicrobial treatment, even, quite frankly, even compared to just doing nutrient infusions to help patients with their mitochondrial function, energy levels, correcting certain deficiencies or whatnot. I see those flaring up patients not that commonly, but I see that happening much more often, relatively speaking, than folks flaring from ozone therapy. Seems to be, by and large, quite well tolerated, and it's one of the many reasons that I love ozone. So there were some other questions around ozone therapy that I will answer in subsequent videos. If you have any questions about ozone or any other topic that I seem to like to talk about, just fire away.